Hello, everybody. My name is Jalen Motley. I'm a program coordinator here at VitalLink. I want to thank all the students and educators joining us today for the Mount San Jacinto College Nursing and Allied Health, EMT, and Fire Technology Industry Panel. At this time, I will ask one more time to please mute yourselves, turn off your camera, just so we can highlight our awesome panelists. All right, and I also want to thank our group of panelists for being here today and giving us their time to speak with you all. I am really excited to hear everything they have to share. The chat room will be open for any students or educators or parents to ask any questions, and I will either do my best to incorporate that into our discussion, or if the panelists, if it's a direct question for them, they can always chat you back in the chat and everyone will be able to see that response. So we'll get started with some introductions. Let's start with Mr. Lopez. Give us your name, title, company, and a brief background about where you're working.
Yeah, absolutely. My name is Fabian Lopez. I'm the Director of Emergency Medical Services out at Mount San Jacinto College in Mount San Jacinto proper. I have a background in EMS since 2004. Oh, that was a while ago. Started out as an EMT. Went on to become a volunteer firefighter and then later paramedic. And then I kind of made my way to teaching. And so I've been teaching EMS, Emergency Medical Services, since 2017. And I teach EMTs and paramedics and American Heart Association classes and anything else they let me get my hands on.
Awesome. Thank you. Mr. Julian.
Thank you. My name is Valerie. I'm the Diversity and Inclusion Coordinator for the Orange County Fire Authority. Our company is organization. We're a joint powers authority fire service organization. We serve 23 cities in Orange County. We're run by a 23-member board of directors, with one representative from each city that we support. And like most fire agencies, we provide fire suppression for residential, commercial, and wildland fires, as well as emergency medical support for those that need that. So I guess a little bit about my background. I actually don't have a fire service background, but I have been hired as their first diversity and inclusion coordinator. This is a direction that the authority wants to move in around how do we make our organization more inclusive and supportive of the diversity and the needs around our staff and personnel, both on the safety and non-safety side. And just had my first fire captain academy training with the yesterday, so that went really well. So I do have a background in higher education, nearly 20 years in the field. My last position was an assistant dean of students. So I definitely shout out to the collegiate environment, and it's an environment that I'm very familiar with. And so for you students that are here today, wonderful opportunity for you to be here. So thank you.
Awesome. Thank you, Julian. We'll go to Mr. Chuck.
Hello, everybody. My name's Chuck Torres. I work with the City of Costa Mesa. I am an administrative training officer for our fire department. A little bit about myself. I got hired in Monterey Park as a firefighter paramedic in 2000. And before that, I was a private paramedic out in San Bernardino County, worked out of the Redlands Division with AMR. Worked as a paramedic for 20 years. When I transferred over to Costa Mesa in 2002, I was a firefighter paramedic there, got promoted as captain in 2017, and worked as a floor captain on an apparatus up until Monday. And then Monday, I was promoted into my new position right now here in City Hall. And now I'm on a 40-hour work week, and happy to be changing roles.
Well, congratulations. That's awesome.
Thank you.
Yes. Daniel.
Hello, everyone. My name's Daniel de la Vega. I started training in 2008, right out of high school. I did my first EMT course here locally in Menifee, California. Got hired with AMR in 2011, Riverside. I was an EMT for 2 years, and then I went to NCTI in Riverside as a paramedic program. And I've been a paramedic now for about 9 years. During my time at AMR Riverside, I was also a paramedic preceptor. So I took in paramedic interns, evaluated them on patient assessments, drug administration, stuff like that in the field. I've also had EMT students ride out with me as well. And right now I'm currently one of the primary instructors at Southern California EMS Training Institute in Wildomar, California.
Awesome. Thank you so much for sharing, Daniel. And lastly, Dr. John.
Hello, my name is Dr. John Kaplan, and I am Dr. John's Nutrition Health. It's just me. I'm my own boss. I work at home, and it's video conferencing primarily. I am first. I would like to say that I'm honored to be amongst other professionals in the health and health-related fields, and the educators that are among us. And I'm also honored to be in the presence of all these young people who aspire to participate in caring fields that are geared to be of service to other people, and you are desperately needed, and you have great potential to make a terrific impact on health, which is my preoccupation. Now, I spent 35 years as a board-certified practicing obstetrician and gynecologist. I'm now a full-time plant-based nutrition consultant. I do all my work online. And again, I think we'll flesh that out a little bit further as time goes on. But again, I'm honored to be here, and I'm glad for all these students to be participating. Thank you.
Thank you so much, Dr. John. All right, well, let's get started with the rest of our interview. Okay, Julian, I'll ask you this first question. What is your background in relation to nursing, allied health, EMT, and fire technology?
Well, that's an easy answer. As I shared earlier, I don't have a direct background, but with respect to where, again, the Orange County Fire Authority wants to go in terms of DE&I, diversity, equity, and inclusion work, I have done that work nearly for 20 years in higher ed, conducting, numerous cultural, identity programs for students, inclusive programs and activities. So that background directly relates to this position. And it has been a great fit. So I want to encourage students that, you may end up on a certain pathway. And if, with your background, you don't sometimes know how that could apply to other areas. And it's not that this has been a great fit. I've been on board for about 8 months and counting. And there's no end in sight with where this is going, which is a great thing. There's just a lot of projects to work on, a lot of great staff to work with. And it's similar to Chuck, being able to transition to something new, there's some great surprises along the way. So just keep an open mind and open heart to where your journey takes you, because doors can open up at any point. And so, but to that said, again, the DEI is what they're looking for. And that's what I was hired with, that expertise and background to be able to, create some meaningful changes in the organization. So.
Yes. Julian, what is your background in relation to EMT fire technology? Oh, sorry, I meant Fabian. Sorry.
I think I just answered that.
So my relation, currently teaching EMTs. Prior to that, I was a paramedic with Riverside County for AMR, transport ambulance. Goodness, busy car. We're in the middle of the city. Did a lot of work with them. I was a volunteer firefighter for a time as well. And yeah, that's kind of my background. EMT as well, had numerous individuals that I was training, EMT ride-alongs, paramedic ride-alongs, paramedic students that I was evaluating as well. I was also served as a clinical coordinator as well in my time in education. So a lot of good stuff.
Great. Okay, thank you. And Dr. John, I'm very curious about your background in relation to nursing and allied health before your time in nutrition.
Well, of course, I have a lot in common with those aspire to the health professions. I've been a caregiver in the medical field for, well, it was more than 35 years. And what changed my career was that I'm the oldest person in the room, I see, and that I was beginning to develop some medical challenges, borderline hypertension, hyperlipidemia, or borderline some arthritis, And I thought, is this what it's going to be? Is there no way? Is there no way out? Was this inevitable? Am I going to have to get used to it? And I was introduced to a book by one of my intellectual mentors, Joel Furman, Eat to Live, which he published a couple of decades ago. And I had an epiphany. All the chronic suffering that you see, and most of you who are present in this room have encountered it, whether it's related to heart disease or hypertension, strokes, or what have you. Most of it is actually preventable and even in many cases reversible. But you need some knowledge and also particularly application, and it's all very possible. I've read extensively, and I've worked with a lot of people, and I see nothing but miraculous responses. And I'm very excited about it. You could be too, if you're interested. And well, that's how I relate to nursing and allied health.
Awesome. Thank you so much. That is so great. Okay, let's see. Next, Mr. Chuck, does your company offer any internships, apprenticeships, job shadowing, or any other volunteer opportunities for students?
We do. We have 2 different programs. One of them is a Fire Explorer program, which is run through the Boy Scouts. And it is for kids that are 17 up to 21. And what they do is they come and they train 1 night a week, and then 1 weekend for a few weeks as they're getting their task book signed off. So then they learn a bunch of things that we teach them. And then when they finish their task book, they're allowed to wear a blue shirt, light blue shirt, and then spend some time in the fire stations. So then they get to see firsthand what's going on and get to experience life inside a fire station amongst career guys. They do run calls with us. They work side by side. At 21, they get timed out. And that's because of Boy Scouts, right? We also have a fire intern program here in our community risk reduction section of our department. And there they work hand in hand with fire inspectors overseen by a fire marshal. So they get a lot of experience on that side as well. That's it for our internships, but there are other departments out there that have reserve programs where if you have a academy graduation, they'll bring you on as a reserve, and then you work X amount of shifts a month, and you work side by side with the firemen.
That's great. So being a part of these programs can kind of help set you up once you're graduated out of that program and maybe a job in the future?
It's not required, but it really, really helps.
Okay, well, thank you for sharing. Daniel, does your guys' company offer internships, apprenticeships after kids have finished in your programs?
So in our EMT program, part of requirements to actually pass success.
I think your audio may have cut out just a little bit. Let's see. No worries. Daniel, can you hear me? No worries. I think his audio may have just cut out a little bit.
I can probably help him out if you'd like.
Yeah, Fabian, would you like to answer that question?
Yeah, absolutely. So Daniel and I are kind of in the same industry in that we're teaching EMS professionals. Both EMT and paramedic have internships that are provided from their schools. And these are necessary requirements for students to actually complete prior to going to the national certification. Now, as a program, typically what we do is we educate individuals in preparation for that national exam. Once they leave us, we certify them as having the knowledge base to take those national exams and be successful. And in that, it depends on the school and how many hours they actually spend in the field. For us, we have a 36-hour requirement for our students, which they spend time in the field, both in the pre-hospital side and in-hospital side, where they're actually in the hospital working alongside ER techs, nurses, and doctors. But also we've incorporated pre-hospitally are 911 ambulance provider too. So they get both worlds as far as EMTs are concerned, in that they can see what it's like in hospital and out of hospital. So if they are looking maybe to be a firefighter down the road, firefighter, paramedic, EMT, they get that experience. But also, if they're looking maybe towards the medical field, nursing, PA, medical assistant, those types of things, it's a great kind of crossroads to get an introduction into the medical field in general. And that's basically what I'm sure that Daniel was going to say as well. We kind of share that. Daniel, did I cover it?
Yeah, I was exactly going to pretty much say the same thing. So we do have like the ride outs and clinical setting as well, part of our program. The ride out is contracted with AMR here in Riverside. So you do have the opportunity to go on a busy 911 ambulance with the paramedic and an EMT, get exposed to the pre-hospital setting if that's what you want to do, like the paramedic route or the firefighter route. We do have 2 local hospitals that you can schedule clinicals. So like Fabian was saying, if you want a career more in the hospital setting, like a doctor, PA, and nurse, I think that's a better environment, given that you can work inside the ER and see how things go there.
Great. And also, Daniel, what 3 skills would you say students should build on to work in your field?
For me personally, social skills. Coming out of high school as a very shy, quiet kid, and once you go into this field, you will develop more social skills. You know, you have to talk to a lot of people from different backgrounds. So social skill is one. Teamwork, you have to work with all kinds of people, and again, different backgrounds. So you have to be able to adapt and work with those people. Also, critical thinking skills. You can have multiple problems at one time. The one that's also important for me when I look for a student in is coachability. You know, how receptive are they with what we're teaching them?
Yes.
Yeah. Julian, I see you shaking your head. Is there anything you'd like to add to that also?
I'm just ditto on all of those, Daniel, for sure. I would definitely say, and I'm going to throw in the, as it's an emerging area and for a lot of organizations around, again, addressing our current world with diversity, equity, inclusion issues, is having some competency in intercultural competency work. And you can take courses in college that actually give you some insight into that, social justice, some of these sort of terms that are synonymous with DE&I, but just some sort of, some articulation around what is diversity, right? How does that, how's that playing out in our world and communities, right? In society, looking at issues of equity and fairness, right? We a lot of this stuff is actually in the news. We're hearing stories around these things, around people's lives all the time. But it's also, these things that impact organizations and staff and personnel and how they do their work and engage. And oftentimes there can be, a lot of conflict can come out of just, not knowing or just being, I would say unintentionally ignorant of just what's going on in other people's lives and just how things are changing. And so just understanding sort of those facets of, of a work environment of just, again, having some intercultural sort of knowledge and competency will bode you extremely well going forward. I would say no matter where you go, because where you people, you're going to have, these issues. And thank you, Daniel, for saying, having that sense, communication, interpersonal, right? That's just key. Know how to work with others and work with different audiences and, from, colleagues, peer connections to folks that are higher up than you, perhaps in an organizational structure, right? Knowing how to engage. And you get that through a lot of practice and just time in a career field, right? In a pathway, but just focus on that. The last thing I do want to say is for fire service work that I'm saying, you definitely want to have some mechanical aptitude. If you're going to be on the safety side and you want to pursue, right? And Fabian and Danny, I'm sure you can tell, I've been on a couple of ride-alongs and I can tell you the knowledge that they have about how to work the apparatuses and all the equipment, it's really amazing. So knowing having some that mechanical aptitude is key if you want to go into this particular pathway. And Fabian or Danny, if you want to just, but that I for sure is necessary.
Awesome. You guys all just gave great skills. Students, I hope you guys are listening. This is great. Dr. John, you being in the nursing and allied health sector, what 3 skills would you say students should build on to work in your field, and even nutrition?
Yes, to work in the field of nutrition, you have to understand your personal motivation to do that. My motivation is that I understand and am capable of helping or assisting other people in discovering avenues to regain exuberant health under circumstances where one might otherwise be skeptical that could occur. Right now, our general approach to medical care is prescription medications and procedures, which at best just temporize and don't deal with the root causes of illness. But it's actually possible to make an impact. But you need a knowledge base. Okay, so knowledge base would be number one. Yep, you need to understand the field and also, in other words, you have to know the field so that you can help others. And I'd say possibly the most important is personal immersion. You can't teach anyone anything that you don't actually identify with. If you don't believe in something, you can't convince anyone else of the validity of it. So you have to be personally involved, committed. And then the last would be compassion. People are suffering. Okay?
Absolutely.
And you have to feel their pain. You have to understand what's necessary to be of assistance to them. And that takes compassion, some understanding, compassion. Thank you.
Absolutely, thank you. Mr. Chuck, what certifications, licenses, or related badging should students work on for your industry?
That is a big question that I get all the time. Well, there's a certain path that you go down to be a firefighter, and right first when you would hit Fabian and Daniel, and you'd become an EMT. Right, that's the first thing I did right out of the box, and then you go and you start gaining experience, right? And at that same time, if you're out of high school, if you're in high school, then you find a Fire Explorer program. If you're out of high school, go to college and start looking into fire technology programs if you want to pursue that avenue of it. Here in Orange County, it's highly unlikely if you would find a job as a fireman if you don't have a fire academy with fire technology education behind it. So then you would have to have your AS degree in fire science. At that same time, you're working with EMT and gaining experience. So you're gaining all these certificates. Inside the fire academy, I think you come out with like 12 or 13 certificates.
Wow.
There are other academies out there around California that don't require education, but fire academies here in Southern California pretty much have are associated with community colleges, and you will gain the education side of it as well as the manipulative hands-on experience. Yeah. And then from there, right, your next step is you gain your hours as an EMT, and then you go into paramedic school.
You come see me again.
Yeah, and then you're back to Daniel. You're back to Daniel and Fabian, and then from there you go out and you start working as a private paramedic, and then as you're moving forward, you're pursuing your 4-year degree on top of that. I will be strictly upfront with everybody who's listening right now. Here in my city and surrounding cities, but I know for sure in my city, you will not get hired as a firefighter in our city of Costa Mesa without a 4-year degree.
Wow, okay.
We have been
That's very good to know.
moving forward in strictly hiring 4-year degree firemen. So that
is that a newer thing that's been going on?
What's that?
Is that a new requirement, or has that always been?
Well, it's not a requirement, but that's what's happening.
Gotcha, okay.
There's your next 6 years, kids.
Yeah. Great. Well, thank you so much for sharing.
Sure.
Dr. John, I want to ask you the same question just because I think students who do have a interest in nutrition, they would love to hear about what you would have to say about certifications, licenses, anything like that, or what you got.
My recommendation for someone who wants to enter the field of nutritional consultation is to accumulate a credential in some medical or paramedical or allied health field, and that could take many forms: registered nurse, registered dietitian, physician's assistant, a medical doctor, a physical therapist. It doesn't matter so much. It's where your passion lies. So I would start with of course, a four-year degree.
Mhm.
Okay, and then go on and be credentialed in some health-related area. And then if nutrition is your passion, there are ways to get extra knowledge and certification specifically in nutrition. I'll list off a couple of those agencies that would be empowered to do so. Also, I can be contacted through my website, and I'll be glad to respond to it and be helpful, because we don't have enough time to go into all the details. But the Physicians Committee for Responsible Medicine, otherwise PCRM, the Center for Nutritional Studies out of Cornell University, the American College of Lifestyle Medicine, Rooksby Culinary Institute, Forks Over Knives, and the Plantition Project. These are just a few of the agencies through which you could get some type of credentialing or further education to ready yourself for a career in nutrition consultation.
Great, thank you so much. And you said those are on your website?
No, but
sorry, I thought you said you had them listed. But if you want, you can also drop them in the chat, and then the students will be able to see the list you just named.
I am available. Thank you.
Awesome, thank you. Okay, Julian, next question for you. What experience would your company look for on a resume for an entry-level employee?
That's a really great question. I would say that depends on the position. You know, we don't just hire for safety. We hire, when I say non-safety, it's the non-firefighting sort of pathways. So that would include, you know, HR positions, finance, you know, all those other supportive departments that helps to run, right, the organization and support the firefighters, to be quite honest. And there's even a really neat one side to this, the fire prevention specialists who go out into communities and inspect. And again, Fabian, you know, you know all of this, I'm sure, but their work precedes, hopefully, you know, what happens when, you know, there are, you know, fires that have to get addressed in residential community structures. But they go and make sure that, you know, they're inspecting buildings and make sure that everything's to code and from new to, you know, older, you know, structures. So that's a really, really neat side, but it really depends on the position. And so if you're going to go into I would say kind of the non-safety side of things, right? I would just say have a balance of hard and soft skills. You know, the administration, you know, it's a pretty wide area, right? And again, I just kind of talked about some of those departments, but having, you know, technical skills, how to work with technology, computers, software, right? Different platforms, that allows you to adapt depending on what systems you might have to use in a particular position. Project management skills, kind of highlight some of the things that you did, you know, around project managing. How do you, you know, work with other people around that? And also interpersonal communication. That's, you know, more of the soft skills. Like how do you deal with others, right? Conflict and, you know, how do you stay focused? How do you encourage and empower, you know, others that you may supervise, if for some of you who have this sort of experiences. Not every entry level, you know, comes without some skill. I mean, you know, it just depends on the position. And so if you have those things, highlight them. I would just say a really nice balance of hard and soft skill and current technical skills.
Right.
Don't put on things on your resume that, you know, nobody's not going to use, like, you know, maybe search engines, things like that, you know, in terms of technology, like how you know, find information. Just put things that are relevant and that are current. In industries that are, you know, people are using. So
great advice. Thank you so much. Daniel, same question for you. Experience with your company that you guys would look for on a resume.
One of the bigger things is like customer service. If you have prior experience with that, prior experience of dealing with the public, you know, and pre-hospital setting and hospital settings, you are dealing with the public on a daily basis. And like Julian was saying, you know, communication skills goes a long way, not only with your peers, your supervisors, but the patients you will be in contact with. Also for me, again, going back to some of the skills you may want to work on is the coachability stuff. A lot of our stuff is, you know, skill-based psychomotor stuff. So you have to be able to not only critically think, but actually perform the task at hand with your hands and actually doing an assessment and skills.
Yes.
Great, thank you so much. Mr. Chuck, I am actually very curious as to what your answer will be to this question. How do you handle adversity on the job?
You know, that was the question that I looked at this list here that you gave me, you know, and I was thinking to myself, that's a pretty good question, because there's a long story to it and there's a very short story to it, right?
Mm-hmm.
Short story to it is that I used to use is just deal with it, right? But now looking back, but getting this job, getting the firefighter job took me about 5 years. And what I tell everybody when they come and they ask me and they sit down with me and they say, hey, what do I need to do to become a fireman, blah, blah, blah. And I lay out their, you know, their plan. And I tell them, you have to be willing to put in the work, right? And because this is where I was confronted with adversity. 83 times I was told that I didn't get the job, right? And that was 83 times. And I was married at the time, looking at my wife and going, well, there's another one. There's another one, right? But at some point when you're ready and when the time is right, that door opens up. And when it opens up, it's going to open up like floodgates. Because I went 5 years without getting a job, but I kept pushing forward, getting all the experience, getting the certificates, putting the time in, putting the volunteer work in. My resume, going back to what I forget who mentioned the resume, but getting that relevant information to be on my resume. And then finally, I had like 6 chief interviews, right? All within 2 weeks.
Yeah.
And one of them, I went to the chief interview and I said, he goes, are you on any other list? And I said, yes. And then he goes, I can't be talking to you then. And I said, I'm sorry. For the last 5 years, I've been trying to get to this point, and I'm never going to say no to anybody if you tell me to come sit here with the chiefs, right? So
yeah.
My thing with dealing with adversity is you just keep at it.
Yeah.
You learn from your mistakes of what happened or why you didn't get it. You do a real deep self-evaluation of yourself, and then you write down and you change things. Don't keep doing the same things.
Yes.
Reevaluate the situation. I use the acronym when I teach the rookies here, and because there's times that there'll be tasks that they're accomplishing and things will go wrong. So one of the skills is flexibility, right? So I use the acronym STOP. You stop, you think about what's happening right there, you observe, you orient yourself to what's happening, right? Real quick, you do that real quick, and then you plan, and then you proceed. Right? So when you're doing your self-evaluation, when you come back or you receive bad news or something's not going right and you're dealing with adversity, that would be my advice, because that's what I use. That's what I've learned over all these years.
Yeah, that's great. And that's awesome. Now look at you. You are in the position you're in, and you are, after years, and like an 83, that's crazy.
Yep. I kept all of those job flyers because I wanted to, when I go and talk to kids, I pull it up and I say, I could have easily stopped at 10 and people would have been like, okay, 25. At 45, my dad came to me and told me, Mijo, it's time for you to think about going to a different job, thinking about doing it. And I'm like, nope, this is it.
Well, that's awesome. That's very inspiring too.
Don't ever give up. Don't ever give up.
Yes.
Yes. Fabian, I see you shaking your head a lot. Do you have an answer for the adversity question?
Oh my gosh. So Chuck, like everything you were saying was speaking directly to me, because I was chasing the fire dream for such a long time. That's why I got into EMS. I wanted to be a firefighter, so I went and became an EMT, went and became a volley, and then I went onto my paramedic and did this and that. I took those fire tests and I had that big stack. In fact, I still have it at my house, a huge stack of applications that I went through. And what I found is that, you know, the biggest part of this career field is that it's a very difficult career field. You're dealing with sick patients. You know, from nutrition to nursing to fire to EMS, these are all sick patients, and you're called to minister them and to administer health care to them. And I think the biggest thing is grit. You know, not everything is going to go the way you planned every single time. You're going to get knocked down. Things are going to be disappointing, but at the same time, you have to turn around and say, this is a part of the job. And, you know, looking back at that stack of applications that I put in, when I started, I would have never thought I would have been in education. Not a second. I was hard set on being a paramedic firefighter. That was my calling. And, you know, as time progressed, I started getting some partners that weren't all that great, and I helped build them up. And by the end of our run together, they turned out to be really great clinicians. And so I took that and I kind of transitioned that into education. And man, here I am. You know, and I will say this, kind of echoing what Chuck said. To get into anything in medicine, you really need to get those higher education, bachelor's, master's, doctorates. That is going to take you super far. Experience is there, but at the same time, if you have something that can quantify your experience, like a piece of paper saying that you're a graduate of a university, community college, and associate's degree, you know, I would say at the minimum, those go huge on resumes, and they put you head and shoulders above many of the competition just in that alone.
Mm-hmm. Thank you so much, Fabian. And we are going to start wrapping this up, but before we go, I want to ask Dr. John, what final advice do you have for students who are interested in this career field and maybe they're not sure where to start?
Well, you've talked about adversity and how would I interface with that, and the other presenters are mostly addressed it in terms of rejection and how does one face the issue of rejection. That's very important. But when I think of adversity, I'm thinking about conflict, and that's interpersonal conflict. When you have two or more people together, you have plenty of opportunities for conflict or differences of opinion. But I think an attitude of humility actually can prevent that sort of conflict. What do I mean? I mean that I'm confident in my knowledge base, but that doesn't mean that I know exactly what you're interested in or what I think would be best for you. And I have to remember that at all times. I can be confident, but I have to temper that with humility. I need to work with other people, and I don't pretend that I have all the answers, or that I'm completely right, or that I can't learn something even from my client. I can learn something from everyone. And that is an attitude which I have cultivated over many years of experience. And it generally helps me avoid interpersonal conflict.
Great. Thank you so much, Dr. John. You guys have all been amazing panelists. But lastly, Julian, I want you to finish us off with what advice you would give for kids that are interested in this field but not sure where to start.
Participate in either our fire cadet program or reserve firefighter. I think that will give you an exposure to this work, and particularly on that side of the fence, right? Fabian and Daniel, I know you both can speak to this largely, but yes, get your feet by just, you know, pursuing those. You'll know probably fairly quickly if this is the kind of work that you were meant to do. And, you know, unfortunately, we don't do it outside of those programs. You know, we're actually going to be doing a job shadowing program, but, you know, take advantage of those types of, you know, very, very, you know, early exposure to, you know, certain industries that they provide. And so I would say get involved in the cadet or reserve firefighting. We have, I've provided the links for that. So you can, you know, go to our website and see what we require. You just apply and then just kind of go from there. But that's probably the best way you're going to know if this is what you're meant to do. So
absolutely. Well, thank you so much to everyone who joined us. I really hope this panel session did help any students, educators, or parents that were participating. And a special thank you to our panelists just being here and giving us their time. And I thought everything you guys had to share was amazing or inspiring. And so we were very lucky to have you guys here today. I do want to show you guys just a reminder that this community will be up. The event will be going on through the end of the week, and as students, educators, parents, you guys will have access to this throughout to the end of the school year. So make sure that you guys are looking through here. We have over here, you will find an enrollment page for MSJC if you are interested. Different MSJC pathways, explore all of these tabs. They'll take you to great web pages that are full of information. In our nursing and allied health button right here, we have about the MSJC nursing and allied health, certificates, workshops. Make sure you guys do those. I will be asking you to turn them into me by the end of the week. More information about the EMS program, diagnostic medical sonography, and salaries and photos, see what the program is like, and also our awesome exhibitors who were on our panel today. There are a few that weren't here, but you can look at Dr. John's page, EMS training, Medical Advancement Center, and the Orange County Fire Authority. So make sure you guys are clicking through those. There's tons of great information on them. And we are so happy for everyone that came to join. I hope you guys all had a great time. Thank you so much.
Thank you.